It's nearly the end of the summer break, and I'm from Melbourne. It was a pretty weird summer, actually. But I hope for many of us we got to have a break, either locally or a little bit further afield, and that was good for both your mental health, but also for those of your family and friends. And my other shout out is the pandemic does continue to impact our lives. I really want to say thank you to all the people who are working with those in quarantine, and to shout out to those who are in quarantine or who are waiting to get to Australia. Good luck.
First question. What can declining mental health feel like for someone who has never experienced it?
Yeah, thank you. That's a really important question, because it's one of those things that is pretty strange when it happens. But I'm going to start with a change of mood. So a change of mood, we all have mood changes, but when you start feeling like you can't shift from being down, that you're more irritable, that you don't want to do the things that usually give you enjoyment, that, I don't know, your sleep or your appetite might have changed and you feel like there's no way out, that's a very common way to experience depression. And the opposite of depression is a thing called hypomania, when you have an elevated mood and heaps of energy and you probably don't need any sleep. And that might sound like it's great, but your friends or your family will notice that you also can't focus, that you're irritable, that they can't stop you, that your judgment is poor. And sometimes that poor judgment results in really difficult things like spending too much money or getting in a relationship that's going to cause you damage or the other person's damage, and it can really, really, really disrupt your life. And probably another really important way to consider is things that probably most happen to people in their younger adulthood or late adolescence, which is feeling really different, feeling like the world around you has changed or you've changed. And you might experience that. Probably it might get worse, by the way, if you use amphetamines or methamphetamines, but you might feel like people are talking about you or stealing from you or even putting thoughts into your head or reading your thoughts out. You might feel like something's different on the television that especially relates to you, or just generally withdrawing from things, dropping out of school, dropping out of university, disappearing into your bedroom. And that is referred to as, or is probably typical of psychosis. And the reason it's called psychosis is because how you experience the world is not grounded in reality. And that can be really frightening. It can be really frightening for the people around you, especially if you don't see that what you're experiencing is part of an illness and you need treatment. But for any of those things, the important thing to remember is that you should reach out. You should talk to people. You should get professional help, but also talk to your friends and family. And really, in some ways, when you start feeling that change, the earlier you get in, the better. So help is out there. Thank you.
Second question. What practical tips would you recommend to strengthen your mental resilience?
Yeah, mental resilience is a really important thing. And of course, we're all born with the genetics we have. And a lot of how we grow up is really based on our experience as very young people, as babies. And I think one of the things to remember, particularly as a parent, which I have to say I'm not, but that getting consistency and positive experiences, but also setting boundaries, setting limits. And if you think about it, as we grow up, when we're very young, we expect our parents or our teachers to set those boundaries. But as we grow up, we develop internal boundaries. And that just helps you work out what you can do and what you can't do. And that's really important, because having that internal compass that guides you and in your work or in close relationships, it's really important, because when something goes wrong, you can, like a relationship breakdown or, heaven's sakes, even COVID, you know who to talk to, you know how to manage those feelings of grief and anxiety, and most importantly, you know that you'll get through it, because you know you've got these inner strengths and inner understanding. So you can always get better, more resilient. You can always learn more about it, but it is an important part of our lives.
And finally, my child is anxious about going back to school. How can I help?
Yeah, well, firstly, of course, that's understandable, and in fact, I think it might be quite common, especially for those people who maybe missed out on a lot of school last year. So school's about community, of course. It's about getting back into a classroom with other people, a more disciplined environment, reconnecting with friendship groups. There's lots more people around. And for many young people, we've heard a lot about distancing and a lot about needing to take care of our physical environment. So it may be a tough time. But also, getting back to school is really important because it's just as we were talking about, it's a really important part of our social development. So the first thing to remember is to talk through this as a family to make sure you're all on the same page, that we're living through a pandemic, things are different, but we're doing okay. Remember all the things you can do to keep yourself safe, like washing your hands and, keeping aware, in some places wearing masks. But I think the other thing, if your kid's having trouble getting back to school, then talk to other people. You might get some really good tips from childcare, from the child's teacher, from school counselling. The important thing is to get through this, and for many, many people it might take a day, but you will get there. But if your child is really, really, unreasonably terrified of going back to school, then you do need to reach out and seek some professional help. But it's understandable, it goes away, but it's important to get through it. Thank you very much.